Well, 2020 was many things, but it'll always be known as the year of the COVID-19 pandemic.
The pandemic has introduced us to many local and national experts working on the front lines of the virus, and one of them is a familiar face here on Live at 4, UW Health's Dr. Jeff Potoff.
He has become a regular here. He's back for one last time for 2020, but certainly not his last time on the show. Doctor, good to see you again.
Good to see you guys.
What is the biggest lesson you and other medical professionals have learned this past year?
You know, I think the thing that was the biggest lesson was how much human behavior would play in controlling a pandemic like this. I think in our day-to-day lives, we just follow the science, and sometimes that can be black and white. And the minute that you throw a whole bunch of other human beings in it and behaviors and wants and needs, things get a whole lot more difficult.
There is some breaking news related to COVID-19. Just within the last half hour, the first U.S. case of that COVID-19 variant that we've been talking about that first appeared in the U.K. has been found in Colorado, a 20-year-old man who did not travel. So what does that mean?
Right. So this is the same B.1.1.7 variant that they found in the United Kingdom. And the fact that this individual didn't travel means that he likely caught it from someone else here in the United States. So he is probably not the first case. He's just the first case that we know about.
Is this worrisome?
You know, it's worrisome in the sense that this virus is more easily able to make people sick with COVID-19. Now, it doesn't make them more sick. It's likely not going to defeat our vaccines, but it could increase hospitalizations. In a lot of parts of the country, that's the last thing that we need right now.
That's for sure. Let's talk a little bit about the vaccines and how will people know when it's their turn to get a vaccine?
I think you'll see various announcements, certainly from your state Department of Health, your county Department of Public Health, and then if you have a primary care provider in a health systems will be reaching out to people, letting them know they have vaccine available and how to get access to that. So I think people will start hearing word of when the vaccine is available to the general public and how they go about getting it based on their specific situation.
The administration of the vaccines has gone pretty slowly, hasn't it?
It hasn't kept up with initial expectations. I think, like anything that's new, the devil's in the details. And I think a lot of areas, health systems, pharmacies that are vaccinating are working through those details. I do know that many of them are accelerating the rate by which they can vaccinate. So I'm hopeful that we can get to these high numbers of vaccinations that we need to get this pandemic over with.
You were one of the first people to volunteer for the AstraZeneca vaccine trial at UW Hospital. How have you been doing? How have you been feeling? Have you been having any side effects at all?
You know, really, it's kind of a boring story. I had some mild side effects, early on, within 12 hours of getting the injection, but really nothing remarkable, easily managed with Tylenol. And since then, nothing. I felt great. I'm healthy. I'm able to do everything that I wanted to do, before I got the vaccine. So I know we plan for, really kind of adverse side effects from the injection, people off of work, and both with people in our trial and people getting the Pfizer vaccine. That's just not materializing. It's tolerated really well.
That is great news. What are your realistic expectations for the virus in 2021?
Yeah, I mean, realistically, this is good news. I do think we are going to see wide distribution of vaccine. We have 2 approved right now. It looks like AstraZeneca is about to be approved in the United Kingdom. We're hearing word from Johnson & Johnson that theirs is getting close. And I think we're going to get good at vaccinating people. And I think it will be a historic moment to see millions of Americans get vaccinated and really push back against this virus so that, next year when we're talking about Christmas plans, we are talking about traveling, going to see the relatives, whether that's good or bad, I think is up to the individual person. But I want to see life get back to normal. I think we miss or we now realize the value of that human interaction that all of us have been missing for so long now.
But people who are anxious to get a vaccine, just to reiterate what you said earlier, should wait for their healthcare provider to reach out to them, or do people need to? I'm sure you're getting a lot of questions from people. You don't have to call and make an appointment or anything like that yet?
No, not at this point. I mean, right now we're in like our fourth group of healthcare workers. So we are moving rapidly through the different healthcare workers, but we haven't yet got to the general population. Before that, we'll see nursing home residents, frontline workers, those that are at risk. I think there'll be two things. One, healthcare systems will be reaching out to you. We also plan on, using the media to advertise what we have out there, where things are at. So I'm hopeful that no one is confused about whether or not a vaccine is available for them when we actually have it available.
Well, hopefully here's to a healthier, happy new year. Doctor, thanks for being with us.
You bet. Thank you, guys.